Because some of the clients I work with are clergy. They come to therapy because they know that their congregation is not mature enough to understand that they too can struggle from a mental illness, connected to Jesus or not. The thing I like about Jesus, he was always very assertive and open with his emotions, right? When he was angry, did we not know? Right? When he was sad, did we not know? Right? But what happens is, from societal times, we were taught that feelings, when they're unpleasant, they are not safe and they are not good. They become bad. So what do we typically do with things that we view as bad? Somebody shout it out. We forget. What else? When we're told a feeling is bad or an emotion, what do? Hide it, right. So as kids, growing up, I went home and I cried. I didn't tell my mom what happened in school. And I was asked, why are you crying? What do you have to cry about? Stop crying. So what's being programmed in my subconscious? It's not okay to cry. Stop crying. When kids get angry, what do we say? What do you have to be angry about? Why do you need to be angry? Do you pay bills around the house? Why are you angry? So what are we teaching that kid? It's not okay to be angry. And so what do we start doing? We start to suppress our emotions. And what we suppress manifests itself in various disorders, which is why we start to become anxious. Right? Okay. What does anxiety look like? So for me, I developed stomach ulcers at a young age because I started to suppress my feelings. I couldn't share what I was going through because the way I saw it, nobody cared. I'm a kid. Kids don't get anxious. Kids have nothing to worry about. So I had stomach ulcers. I tried everything I could do to avoid going to school. I had massive headaches. I had constipation, diarrhea. Sometimes I felt like there was something in my throat, like I was going to choke. Those were my symptoms of anxiety. Because you see, with the symptoms of anxiety, it differs from person to person. So what your symptoms of anxiety may look like, it may not look like that for me. And another thing is, something that will stress you out may not stress me out because we're all unique. We're all made up. Our genetics, it's very unique. So something that may traumatize you won't faze me. Something that may faze me won't faze you. And this is why we cannot judge. Because if we are all uniquely designed, then we don't know each other's composition, our biological composition. And because we don't know each other's experience, then we have no business judging. Correct? All right. Types of anxiety, we have generalized anxiety disorders. Generalized anxiety disorders, we worry about everything. We have racing thoughts. We worry about schools. We worry about paying the bills. We worry about the kids. We worry about our jobs. We worry about gaining weight. We worry about losing weight. So there's no specific thing that we're worrying about. We're just constantly worrying. Social phobia. So with social phobia, it's a fear of being judged. So someone with social phobia would not be able to stand up here and have this conversation because they would be thinking, they're talking about me, they're judging me, they're looking at me. Oh my goodness, I can't. I feel like I'm going to collapse. I shouldn't be in this audience right now. It is extremely different when someone is struggling with social phobia to be in audiences with other people. Then we have panic disorders. So with a panic disorder, sometimes there's just no warning. You just never know when it's going to hit you. You will be sitting around, and the next thing you know, your heart starts racing, you have palpitations, you're sweating, and you feel like you're going to have a heart attack and pass out. A panic disorder. And oftentimes, you're not able to figure out what it is that is causing that panic, even lightheadedness. And oftentimes, these symptoms or this situation lasts, like I said, over a period of 4 to 6 months or even longer. Then we have agoraphobia. These individuals, they may be able to leave the house to go grocery shopping, but outside of that, they're not able to be in open spaces and public spaces because of the overwhelming feelings of anxiety they experience when they're there. Then we have specific phobias. Anybody here afraid of spiders? Flying, rats, heights, right? So that for you is a specific phobia, and if you notice, everyone had something else specifically that they were afraid of doing. Then we have post-traumatic stress disorder that falls under this anxiety disorders as well. So those individuals in the Bahamas, or even family members, or even us who witnessed that catastrophe, we may have flashbacks because of that one instant, and it will last for an extended period of time. We have flashbacks. We start numbing because we can't cope with the memories of it. We start having bodily sensations that's affecting us. And then we have obsessive compulsive disorders. So I hear people say all the time, I'm OCD. They walk around loosely. I have OCD, I have OCD. And to me, that's insulting to someone who's actually struggling with OCD. Because the thoughts, this is the most destructive, I think, of all the anxiety disorders. Because the thoughts are so obsessive that they are unable to control them. Sometimes they use medications, and I know Dr. Lanoche is going to touch on that some more. They need medications to help them. So I had a client who was coming to see me. His skin was gone, literally peeling off of his hand, because he would wash his hands hundreds of times throughout the day, trying to get rid of germs that he was saying was taking over his hand. So someone who's OCD, you keeping your room neat doesn't necessarily mean you have OCD. Yes, you're neat, you like things structured, but when your thoughts become so obsessive that you can't function normally, and you have those compulsions where you go back and you need to wash your hands over and over and over again, or you keep checking the doors, or things need to be in a certain order, and it's affecting your ability to function in school or at work or day-to-day life, and it's been lasting more than 4 months, past 6 months into a year, then it's time for you to go see Dr. Audrey. Why so much stigma? Well, our religious beliefs. Back in olden times, the belief was that if someone was possessed with a demon, they were disconnected from God, and if you had a demon, I was going to stay clear from you because I didn't want that demon to jump out of you and jump into me. Right, Pastor? So I avoid. And so that got passed on from generation to generation to generation. And so people think whenever someone's depressed or they say they're anxious, that they are possessed with a demon. So I am here to tell you that that is not the case. Being depressed does not mean that you're possessed with a demon. Having an anxiety disorder does not necessarily mean that you're possessed with a demon. Oftentimes it's due to a chemical imbalance or a catastrophe, like I said, various environmental factors. Sometimes it's internal factors that cause people to struggle with anxiety. Maybe you have cancer or you have debilitating pain that you're struggling with internally, and it's now leading to anxiety. Because the one thing to note about anxiety is it's the uncertainty that's killing us. So per research, over 40 million people in the United States struggle with anxiety disorder in a given year. 40 million individuals. So 1 in every 5 of you are suffering from an anxiety disorder right now. And it's our uncertainty, our need to always be in the know, that is always causing us to struggle with anxiety disorders. So question for you. What does the Bible say we shouldn't do about tomorrow? Say it again. So why is it we worry so much about tomorrow? Lack of faith, he says. People are so obsessed with knowing what's going to happen with tomorrow that they go see psychics. They try to predict the futures. You guys are laughing. It's true. We're so obsessed with knowing what's going to happen next, and he says it's due to lack of faith. Sometimes it's our experiences as well, that people pay hundreds of dollars just so they can have that certainty. And if you're so obsessed with having certainty, then are we insulting God? Because aren't we supposed to rely on him to take care of us the same way he takes care of the sparrows? Right? Okay. Over spiritualizing, like I said with the demons. So if we see people who are depressed, we automatically say it's because they're possessed with a demon, or it's because they're disconnected from God, or they're not practicing good faith, and that's why they're suffering. Judgment. Everybody judges. Everyone judges. Newsflash. Everyone judges. So I hear people say, I don't judge. That is the biggest lie ever. You will have a judgmental thought pop into your head. However, when that thought comes, it's what you do with it that matters. Correct? Correct, guys? So you will have that thought. So if someone walks in, or you may be looking at me, look, she's not even wearing heels, or her hair is up too high. You know what? I'm going to focus on what she's saying. You just judge me. But when that thought comes, it's what you do with the thought that matters. Whether you become so focused on what's going on around my outward appearance instead of empathizing with the individual who's in front of you. Ignorance. As a people, we tend not to read. We tend not to educate ourselves on our body and our mind. Your body, your mind, and your soul, they are all interconnected. They're not meant to be disconnected. In Western world, what we tend to do is that we treat the body as one part, we treat the mind as one part, and we talk about the soul. So the soul belongs to stuff happening in church. The mind is for a psychiatrist or a psychologist, and the body belongs to a medical doctor. That's not the way it should be. Our mind, body, and soul are supposed to be integrated and treated as such. Say it again, Pastor. Amen. So for me, how I was able to manage my anxiety effectively was when I did research and realized the Bible actually says it, that we are to aim to ensure that we're integrating our mind, body, and soul. If you're treating each one of them differently and disconnected, then what you're doing is you're separating all three. If you're separating all three, then you're going to have an issue. So sometimes the psychiatrist isn't talking to the medical doctor isn't speaking to the therapist. They're all prescribing different medications and messes your system up even worse. So I actually enjoy, and I recently met Dr. Audrey because she's a holistic psychiatrist, meaning she targets your mind, your body, and your soul, which is what you want if you're ever needing to see a doctor because you're having a mental health issue. Someone who's holistic, who targets all three. Because if they're targeting all three, then you're ensuring that they're making sure everything is integrated and she's tackling all the issues from a holistic standpoint. What does the Bible say about anxiety? Do not be anxious about anything, but in everything, by prayer and supplication, by thanksgiving, let your requests be known to God, and the peace of God, which surpasses all understanding, will guard your hearts and your minds in Christ Jesus. Do not worry about tomorrow, for tomorrow will worry about itself. But our need to know what's going on with the future, and that uncertainty is what's destroying us as a people. And Jesus grew in wisdom and stature and in favor with God and man. Wisdom and stature and favor, meaning mind, body, spirit. And really, that's the approach we ought to be taking. Trust in the Lord with all of your heart and lean not to your own understanding. In all your ways, acknowledge him, and he shall direct your path. So when I'm doing therapy with people, I step outside of normal Nikki, and it's me and Jesus in the room. Because I have seen some things, and I really started to wonder if the individual sitting in front of me was demon-possessed. And the only thing that got us out of that session and helped that person to heal was me sitting there praying while I was helping them. So if you're seeing a therapist, it is important that that person's foundational beliefs align with that of your Christianity. Because I don't heal people. I heal no one. I merely provide individuals with the tools and the support they need to do the work, in addition to praying and reading their Bible, to help their body and mind heal. And what I see as Christians is if someone is struggling mentally, We tell them, pray about it. Have faith. Jesus will fix it. But if I were walking down the stairs right now, fell, broke my leg, and a bone started sticking out of my knee, what would you guys do? What would you guys do? You'd pray. That's good. But what else would you do? Blood's gushing, my bone's sticking out. What would you do? 911, right? Would you tell me just to pray about it and have faith that my bone will go back in? No. Why not? Because if I have faith, why can't I just pray about it and have my bone go back in? Right? But that's what we do when someone's struggling with a mental health issue. We tell them, pray about it. So we're quick to send people, go call a medical doctor. And no offense to any medical doctors if you're here, but they prescribe you meds. And what do? We trust the doctor, we take those medications, we suck them up, and before you know it, you're taking 1 meds, 2 meds. Sometimes you're addicted to the pain medication. You weren't addicted to the pain medication before, but then you won't see a therapist? I'm confused. I don't prescribe medications. As a matter of fact, medications is the last resort for me. If I see someone very psychotic and I see that they're really struggling no matter what we've tried, it's not working, then I typically try to find a holistic psychiatrist like Dr. Audrey and refer them to her. And if they go to her and she talks to them and says, no, you just need therapy and you need to try these things, she's not going to prescribe meds. But we're quicker to run to a medical doctor to prescribe medications to destroy our insides than we are to talk about the problems we've been suppressing that's destroying us. So think about that for a second, guys. So therapy, like I said, is a collaborative approach. I do not heal you. Jesus and I collaborate with you to do the work to get your mind, body, and soul interconnected again. Because what we weren't taught is that when a crisis hits you or stress, you have this thing. So picture this as being your brain. Your brain, the front part of your head is where we make decisions, judgment calls, right? Toward the back of your head is where we have what's called our limbic system. And in your brain, if I were to slice your brain in half, we have this thing called the amygdala. Your amygdala is what keeps you safe. It's constantly on guard saying, danger, 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 danger. Don't trust this one's dangerous, don't go there. That's what it does. If it's constantly working over time, your body gets depleted, your energy, because it's constantly going and you're always in high alert. That's when a lot of us gets anxious. So for me, what happened in my 6th grade class, it accompanied me into my adult years. So after that, I believed I was unworthy. I wasn't good enough. I wasn't capable of doing anything. And I believed I was a dunce. And I had to work 4 times as hard to prove to myself and everyone else that I was not a dunce. But I decided to prove that teacher wrong as a child. What about a child who doesn't have that willpower? Imagine what that does to that person. And so until I started doing research to work on healing me, every single time I decided to try something new, guess what I heard? You're not worthy. You're a dunce. My brain kept telling me the same thing over and over again. So I had to go see my own therapist. And I had to do different things to help me heal. No shame in my game. No one prayed more than I did. It got to the point where I wanted to kill myself to shut off the feelings of anxiety because it was debilitating. I could not function. I threw up. I was in pain. As a teenager, I suffered. I had no idea why I was suffering because, again, in our households, we don't talk about mental illness. We don't talk about anxiety. What do I have to be worried about? So that amygdala for me was always on high alert. So every time I walked into a classroom or I was about to take a test, I started to get anxious and nervous. I would throw up. I'd always have to excuse myself from the class. Because what happens is talk therapy is good, but what it didn't tackle was what was trapped in my limbic system. So my amygdala was always active, and trauma and toxic stress gets trapped in your bodies. And that's why you need to ensure that you're going to get help. So going to see a doctor is one thing, but if you're not taking the right approaches to help you, then your suffering will continue. So my recommendations as a therapist, if you are ever needing to see a therapist, you want to see someone who specializes in what we call EMDR, eye movement, desensitization, and reprocessing. I know that's a huge word. Why I recommend you seeing such a therapist is because they have been trained to kind of target your entire system, mind, body, and spirit, and get all that stress that's trapped back here in your limbic system. Emotional freedom technique, tapping. Anyone in here ever done tapping? Okay. Did it work for you? Yes, no? Come on, speak up. Yes, right?
What's tapping? What's tapping?
So what's tapping? Tapping is, he said yes. Tapping is emotional freedom technique. So when you suppress your emotions, it gets trapped inside. And remember in the beginning I said what you suppress manifests, right? So if you're angry and you're always suppressing that anger, or you have things you want to express and you're always holding it back, that's why people have autoimmune diseases or high blood pressure, anxiety. That's why we have diabetes. You have different disorders you're struggling with. So what tapping does is it targets different energy pathways throughout your body. And you have hundreds of them that you don't even know of. And what you're doing, so instead of getting acupuncture, where they stick the needles in those meridian points is what they're called, you're tapping on those points. And what you're doing is affirmations, and you're doing exposure therapy on yourself, and you're releasing all that toxic stress out of your body just by tapping on the different pressure points. It's something you can learn online, but it's good to see someone who's actually been trained in it. And if you're ever seeing someone doing tapping, ensure that they are evidence-based tapping for trauma, because there are different types of tapping. But that's really what helped me. That's why I'm able to stand here and talk to you. I don't feel anxious. And when I do start feeling anxious, because you should have anxiety, you're human. If you're not anxious, something's wrong, you're not alive. Anxiety is what keeps you safe. So when I was driving here, my body started talking to me. You're going to go up there. I started feeling it. And I stopped and I spoke to my body. I said, listen, we got this. We've done this several times before. I talked to my amygdala. Amygdala, I don't need you to act up. I got this. I am safe. I am safe. My husband's laughing because he hears me talking to myself all the time. When I start to feel anxious, I'm like, listen here, amygdala. You're not going to do this to me today. No diarrhea, no vomiting. We're not having this today. And he laughs, or he'll run to the bathroom. He's like, who are you talking to? My brain. But it works. It works. All right, quickly, trauma-releasing exercises. So typically individuals who offer this, they've been trained and certified to work with individuals who've experienced trauma. It's a specific exercise for individuals who have dealt with trauma. There's so many things you can do outside of talking about your past. So if you don't want to relive your trauma, you can actually do different things to help you heal. I work with several of my clients, and I don't know what they worked on in therapy because I use EMDR and tapping. And it allowed them to walk away with their dignity. And that's why I use holistic approaches for my clients, because they're allowed to heal without revealing anything from their past. Tips: do not suppress your emotions. Talk about it. What you suppressed will manifest itself in your bodily sensations, and it will terrorize you. Schedule time for fun. As grown-ups, we forget to have fun. If you're not having fun with your kids at least one time out of the week, you're in trouble. Get support. Jesus had 12 disciples. Jesus always had support around him. But a lot of us, we don't tap into the supports we have. If you notice, when people were suffering, who did God tell to pray and heal? Who did God tell to do the praying and healing? The elders, the pastors, the disciples, right? Because when you're stressed, when you're anxious, you're exhausted and fatigued. Deep breathing. Take 10 minutes out of your time to sit somewhere and just be quiet. If you're always talking, you can't hear Jesus speak to you in your body. And just do diaphragmatic breathing. Positive self-talk. I talk to myself all the time, and because the Bible tells me how powerful I am, no one can tell me otherwise. Because I see in the Bible that I am powerful. No one can tell me otherwise. And I constantly remind my brain that I have power within me that I got from my Savior. Bible study and prayer. Again, if you're not reading, you won't have those Bible verses to help you. Get connected. Get the support of a therapist to help you. Be open-minded. Don't go to therapy and be closed-minded. If you're not open to learn, then you will not be willing to change your behavior. If you're not willing to change your behavior, then you're not going to heal. Educate yourselves. So I put some resources on this sheet to help you guys. Please utilize them. Share them. If you're someone who doesn't have insurance, that's why I put low-cost therapy, openpathcollective.com. You can get a therapist for as low as $40 a month. With that said, I thank you guys for your time. I hope that the information I shared is useful for you.
Thank you so much. Thank you so much, Nikki Cameron. Take the mic. Let's give her another round of applause, ladies and gentlemen. You never know what you're going. So we're going to keep it moving with Sierra Hillsman, who's going to be talking about depression. Let's give her a round of applause. Before she begin, once again, if you have any questions for our panel, please, if you could put up the info, text, so that if you have any questions, text in all caps, can contain Junior 176 to 22333. It is anonymous. No one will see your name, and we'll ask the panel the questions that you give. And now the floor is for Sierra.
Good evening, everyone. Thank you so much for coming. Is the mic on? All right. Thank you so much for coming. Obviously, you guys have a lot of questions about mental health and spirituality, so thank you so much for taking advantage of this forum, and thank you for Merge for inviting all of us as well. Okay, all right, yeah. Closer, bam, thank you. All right, so let's talk about depression. What have you guys heard of, or what are some things that you already know about depression? Sadness, okay. Okay, sadness with no help, correct? Anyone else? Nope. Yep, you can't snap out of it. All right, good. All right, cool, beans. Next slide. Sleep disorders. Good. All right, cool beans. Next slide. Pre-fall sensations. Good, yeah. Right. And so a little bit about depression, like it was previously stated, anything that is experienced for a number of months at a time, definitely go ahead and find a professional or a counselor, psychotherapist, psychiatrist, or whatever to help you with these emotions. Depression has a number of symptoms that we can talk about soon enough. Next slide. We're going to completely disregard this slide. Like I said, my name is Sierra. Has my credentials and everything like that. But one thing that I really wanted to note about 61.7, I'm born and raised from Fort Lauderdale, Florida, and although I live in Atlanta, I'm still a Florida girl at heart, Broward County all day. And one thing that I have noticed about my lovely, lovely state is the fact that 61.7% of adults with mental illness in Florida did not receive treatment. And this is a statistic as of 2018. The crazy thing is the national average is 55.8%. So that means that the state of Florida, in terms of the access, is over the national average. Can you believe that? Right. Amazing. Next slide. Great. And so when it comes to access to treatment, the state of Florida ranks as the 44th state. As you can see, it also has like the levels and whatnot. Broward County, South Florida, we're in the yellow range in terms of like the ratio for each clinician or psychotherapist, psychologist, or whatever the case may be, in comparison to individuals who have some form of mental illness. Like it was previously stated before, 1 in 5 adult Americans have some form of mental illness, whether it's depression, anxiety, psychosis. Oh, thank you. Perfect, yay. Psychosis, schizophrenia, bipolar disorder. 1 in 5 adults has some form of mental illness. How does that make you guys feel? Huh? Right. It's crazy, right? It's like, dang, you starting to look at everybody like, okay, it's 5 of us in a row. Which one of us got some form of mental illness? But imagine how many of us actually pursue the advancement of our mental health. How many of us actually pursue the opportunity to be able to take care of these things that we're dealing with on a daily basis. And oftentimes when it comes to mental health or mental illness, we feel like things have to get extreme before we're able to receive the help that we need. Or oftentimes we feel too ashamed or too feeling like we're subjected to judgment, and we want to keep things on the low and definitely avoid them. So, with depression, there are a number of different types of depression. For the sake of time, we're only going to focus on major depressive disorder because it encompasses all the different types of signs and symptoms that some of you guys talked about already. Postpartum depression, how many of you guys have heard of that one before? Right, correct, yes. So that's the type of depression that usually happens after somebody has a baby, maternity-related information, bipolar depression. I just want to negate the fact that people think that bipolar disorder is mood swings, and that's really not the case. It's a lot of in-depth that comes with it, but the depressive side of bipolar disorder is a lot longer than the manic side. And when I'm talking about the manic side, it's the psychosis, the hallucinations, racing thoughts, tangential in speech. But the depression is very deep, and it's the longest version of it all. Seasonal depression disorder, which is also seasonal affective disorder. That's during the winter months. You know, fall's coming up, it's getting darker, particularly when people who live in Alaska or don't have a lot of sunlight or whatever the case may be, they're shut in. The weather really does have an effect, or your environment can definitely have an effect on how you're doing from an emotional standpoint. Treatment-resistant depression. Not a lot of people talk about that instance as well. We're going to talk about some signs or some types of treatments that we can use for depression, but oftentimes depression can be so persistent that maybe therapy or even the medications don't work. Atypical depression, like I said, we'll just go back and talk about the different types of the symptoms with depression, but how many of you guys know people or have put on a mask? Oh, we're not going to talk about the mask that we wear every day. Okay. Yeah. So usually when somebody's dealing with atypical depression, you know, with depression you have that intense sadness, that cheerfulness, and things of that nature. I like to call atypical depression functioning depression, because you can sit up there and go to work. You can go to your day-to-day. You can go to work. You can go to school. You can function in society, and then come home and still feel like you want to attempt suicide. Atypical is basically you're not showing the typical signs of depression. And the last one is depression with psychotic features. Oftentimes with depression, you can have those racing thoughts, or you can have the hallucinations and things of that nature. And excuse me, y'all, I'm really glad that she talked about anxiety, because that's what I'm feeling right now. So I apologize in advance if I'm racing through. Amygdala, get it together. Amygdala, come on, let's go, come on. All right, so different signs and symptoms. Off the bat, you know, you have your affect and your emotional changes. So irritability, agitation, increased tearfulness, that sadness, always crying, finding yourself crying for no reason. And when I say for no reason, sometimes depression just happens. You can be predisposed to it, or it could be genetic. It could be something that runs through your family line, and you may not even know about it. It's just sometimes you have like these periods or these cycles of depression. Hopelessness and helplessness. Thank you so much for pointing that out. Feeling as though there's no way out. Feeling as though you have no support system. Feeling as though like things are super bleak, and being totally discontent with your life. Feelings of guilt and worthlessness as well. Changes in sleep, somebody talked about that as well. Whether or not you're excessively sleeping, or maybe even on the opposite end, restless, insomnia, not able to go to sleep. On the other end, you have the inability to complete your ADLs. ADLs are activities of daily living. So if you find yourself not interested in the things that you once enjoyed, like if you know that you love basketball, or if you know that you love cooking, or if you have that particular passion that gives you life, and then all of a sudden, over time, you find yourself slowly backing away from doing that thing, or finding yourself not in love with it anymore, then obviously you're dealing with some level of depression, or maybe even a life shift. But most of the times, with the loss of interest, you're having apathy, meaning that, okay, I just really don't care, I'm indifferent, it's really not as important to me as it once was. Changes in appetite. Initially, with the DSM, right now we're on DSM-5, which is our diagnostic manual. Back then, it was only seen that with your appetite, people with depression could not eat. Well, people with depression can either not eat or they can excessively eat. How many of us find ourselves stress eating? Yes, stress eating. Or having fatigue, lack of energy, the inability to concentrate because you're so consumed with your problems and having issues at hand. And then just the indecisiveness goes back to the lack of concentration. And changes in socialization. Like I said, with depression, the depression monster, you tend to want to stay in more. The friends that you have or had, they no longer see you anymore. You're withdrawing, you're isolating, you're feeling as though nobody understands you, all of the above. So, yep. Any questions? Oh, we're waiting for questions at the end. I apologize. Let me be in order. My bad. But treating depression. First things first, you can do therapy. Oftentimes, a lot of people suggest evidence-based therapy. There are a lot of therapeutic techniques out there that aren't evidence-based that still works. As a therapist, it really is up to you to decide what works best for your client, and that's what happens with like therapeutic rapport. When you're working with somebody throughout your therapeutic journey or throughout your time in therapy, you get to know one another. You get a better understanding of who your client is, and on the flip side, the client gets an opportunity to learn more about your therapist. And so if you happen to be perusing or searching online for a clinician, make sure you find somebody that's in alignment with your needs, but also in alignment with what you're dealing with in that space and in that time. The number one go-to for a lot of individuals is cognitive behavioral therapy, meaning transforming the mind as well as the thoughts as well. The thoughts as well as the behaviors and just the overall actions as well. And strength-based. Make sure that you're able to identify your strengths. That's something that your therapist will help you work on, because when you're depressed, those feelings of worthlessness and helplessness and guilt, I know it's pretty hard for you to focus on what's good in your life if you can't, if you're dealing with depression. And so your clinician will help you with that when you're working on strength-based therapy. Also, solution focus or reality therapy. Solution focus, that's the type of therapy where it allows you to be able to focus on not only the good things that are happening in your life, but what is in your control. There's a serenity prayer. God, grant me the serenity to accept the things that I cannot change and the wisdom to know the difference. Identify what's in your power and lean on that and work on those as well. Antidepressants. Yes, those are super key, and Dr. Lenoche can talk about that even more. So you have your SSRIs, which is your selective serotonin reuptake inhibitors. I know that was super long. And then you also have your SNRIs, which are serotonin and norepinephrine reuptake inhibitors. And a couple of those types of medications are Celexa, Lexapro, Prozac, Zoloft, Paxil, Cymbalta, Ultram, and Effexor. I know one of the most popular ones is Zoloft, which is a SSRI. And like I said, Dr. Lenoche can talk about that a little bit more. And then overall, too, your holistic wellness. That is so key. If you are going to therapy, don't just think that, okay, I'm going to come sit in my couch, you're going to tell me what to do, and I'm going to just live the rest of my life. No, that's not how this works. It's very collaborative. And it's just like going to the gym. You're exercising not only your mental muscles, but you're also exercising your spiritual muscles. And you're identifying what works best for you. So think about your diet and your exercise. Think about changing up your diet. Omega-3s, as well as like whole grains. Any complex carbohydrate is going to give you that extra energy because you need that glucose. Exercises, that helps bring up your energy in terms of like the dopamine and the serotonin and things of that nature. Also, your social support system. Identify who can definitely help you out of that rut. Somebody that you feel like that is safe enough for you to talk to. Somebody that you feel can give you a shoulder to cry on, or can be patient with you in these times of depression. Now, cost-effective resources and options. One thing that I hear a lot is therapy is too expensive. How in the world can I find a therapist, or how do you expect me to go and get the help that I need when I can't even afford X, Y, and Z? I firmly believe whatever your heart is, that's where your money goes. So I'm one to ensure that you need to be able to set money aside for what works best for you. But if therapy is not in your budget, here are a couple of options that you can explore. The first things first, though, you need to gauge the level of severity of your mental illness. Anything that is dealing with psychosis or like very intrusive in nature or overbearing, don't just pick up a crisis line and think that you're going to call a crisis line every single night. Make sure that you're walking into a clinic. Make sure that you're walking into a facility. Make sure you're connecting with somebody. That way you can get the help that you need. The next thing, too, is just like be mindful of the acuteness of your symptoms. Goes back to the delusions, the hallucinations. Are you able to complete your daily living activities? If not, then make sure you're going and getting the help that you need. All right, so how many of you guys have a benefits package for our working adults out there? Yep, cool. All right, when was the last time that you talked to your HR director about employee assistance programs? Or how many facilities or employers actually have an employee assistance program? True, good. And so with an employee assistance program, it's a benefit package. It's an opportunity for you to go in and get those resources or that mental health assessment or those 6 sessions. That way you can be able to function not only in work but your day-to-day life. People care about work-life balance. And if your employer doesn't care about work-life balance, you need to have a serious conversation with the people that you work with. Because if you can't function at work, then obviously that's going to eventually lead to you potentially losing your job or potentially driving down productivity overall. So with an employee assistance program, check out your benefits and see what's offered in those programs. A lot of times, a lot of those EAPs lean in on professional counselors or professional therapists, and they're able to provide you with the services that you need. Like I said, the mental health assessments, confidential referrals and resources, it's all there at your job. You just really have to look for it and make sure that you know what's included in your package program. Sliding scales. Like I said, when we think about therapy, we automatically assume that it's too expensive, or maybe we get discouraged when we see a therapist's website that's charging $125 an hour. What you can do is shoot them a quick email on their Psychology Today, or make sure that you're in constant communication with them and say, hey, this is how much I can afford, or this is the level of severity of what I'm dealing with. Can you please let me know how many sessions I can get for X amount? Or do you even have any packages that are included in your sliding scales? There are a lot of clinicians that are willing to even do pro bono work. You just have to ask. What they say, closed mouths don't get fed. Knock, if you're right, like the word even says, knock and I'll answer. So make sure that you're knocking on the right door and asking. All you have to do is just ask. And then there are some clinicians or private practice offices that have registered mental health counseling interns. Sorry, it took me a while to remember what it's called because it's different in the state of Georgia. But they have RMCHIs, and they're willing to be able to work with you at a lesser rate because they're trying to get as much experience to be able to get their licensure or become a full mental health counselor here in the state of Florida. So check and see if there's a RMHCI at the facility. How many college students are here? Cool, yep. How many people plan to go to college? Awesome sauce. Counseling services. One thing that I didn't take advantage of when I was a student is the fact that I never went to my counseling services department because I'm a person of color, came from Broward County. I knew, hey, what goes on in the house stays in the house, or dang, I'm not gonna sit up here and talk to some stranger about my problems, or just the misconceptions of mental illness, or feeling that I was too strong or too independent to allow help to help me. And so as a college student, there are a number of resources out there that help you with what you're dealing with on a day-to-day basis, whether it's career counseling, or even giving you a little stress toy, or allowing you to come in and do your sessions. As long as you're an enrolled student and even an enrolled employee, you have access to everything that the counseling services department has. So if you are a parent of a college-educated student or somebody who plans on going to college, make sure that you're letting them know. Make sure you're going to your counseling department. You might as well, you're paying for it. It's coming out your tuition, so make sure you're utilizing it. And that is pretty much it.
Thank you so much. Once again, text all your questions to 22333. Start off by sending Ken Catane Jr. 176 in all caps. Now, last we have the doctor. We will talk about Psychiatry 101. Let's give her a round of applause.
Thank you. So I'm entering that very special age now where it's like glasses, no glasses. So we're gonna see how this goes, okay? But if not, I'm going to need to just look down from time to time. Okay. All right. So, oh, and the clicker. Thank you. Okay, so we'll start out with a little bit about myself. I know it's very hard to follow these two lovely ladies here. They practically said like 75% of what's in my PowerPoint, so I mean I could probably just like go home and have dinner at this point, but they asked me to come here anyway. And so Nikki was kind enough to reach out to me because she did find me online and see that I do try to utilize a holistic approach to psychiatry, and that she felt that that was maybe unique or something that the congregation here might be able to relate to. And so she kindly asked me to come and speak, and so I'm very delighted to be here. So thank you so much. Thank you. Okay, so just briefly, a little bit about myself. I went to University of Arizona for my undergraduate and graduated in 2007. Went on to medical school in New York at New York College of Osteopathic Medicine, graduated in 2013. I then did 4 years of psychiatric residency at University Hospital up in Tamarack. And then I have been in private practice for the last 2 years. So, I'm the current medical director of a community mental health center in Oakland Park. I was the former medical director of a drug and alcohol rehab program called Agape AIM, which was also in Oakland Park. I have 2 private practices that I work in. One is a group practice in Tamarack, and one is in downtown Fort Lauderdale. And I'm the current Broward County chapter president of the Florida Psychiatric Society. So I get to promote fun things happening in psychiatry with the local docs and the community. Okay, so one thing I do just want to bring up is Does anybody here know the difference between a psychiatrist and a psychologist? Okay. Yes, exactly. So basically psychiatrists go to medical school, then they do their residency, they possibly do fellowship, and so then they do prescribe medication. They do a little bit of therapy. A psychologist goes to their undergraduate program and then onto their graduate program, and they're more specializing in therapy. So they may obtain a PhD or what they call a PsyD, depending on whether or not their focus was in research or therapy. So they're the ones that will sit with you, for an hour and kind of go through everything like that. So it's okay if you don't know the difference. I have some of my patients who've been coming to see me for months or years who would still refer to me as their psychologist. So it's totally understandable. Okay, so my motto is more than just a pill. All right, the goal of my practice is to look at people's physical, sorry, let me just pull this up. I wish that screen was just a little bigger for my tiny eyes. Okay, so the goal of my practice is to provide my patients with a comprehensive view of their mental and physical health and how those two things are coming together to create the current state of being that they're in. I do like to, look at the patients, and if they have any medical concerns, there are medical conditions that can either mimic or cause psychiatric symptoms. So sometimes it's appropriate to send patients for labs, to look at their thyroid, look at their hormones, look at their, see if they have anemia. We kind of recommend people to get blood work done with their primary doctor once a year just anyway for their health. It's not necessary per se to do blood work before starting a medication, unless there's something specific about that medication that you might worry about, like, oh, this medicine might change one of your electrolytes, and so before we start it, we would want to look at that. But we don't always need to do that ahead of time. But certainly if I've been trained through my medical training to hopefully recognize a medical condition and then refer the person out to the appropriate provider. So when patients come into me, I'm going to look at them for specific symptoms and severity of those symptoms. And so, I mean, these lovely ladies really did a great job on talking about this. But, I think in the population at large, since I've become a psychiatrist, it has sort of felt at times like a me against them, kind of thing where people do have those misconceptions about mental health, mental illness, and definitely about what a psychiatrist does, who they are. I think they often think that, oh, if I go see a psychiatrist, they're gonna be some dodgy old person who's gonna be not look at them and just say, oh, here's your medication, come back in, 3 weeks and tell me how it goes, and oh, what was your name again, and okay, I think that that's what people think, and so it puts them off a little bit about, seeking out a psychiatrist. So I'm hoping that, myself and these lovely ladies, we can be a part of a new kind of viewpoint or sort of generation, so to speak, of mental health providers where people would feel comfortable, okay, I can relate to her, she seems to be, pretty normal and down to earth, and that she would be realistic with me, she would tell me, what her thoughts were on something. So people do, I find, they are fearful of, having a diagnosis or being told they need to take medications. So I wanted to talk a little bit about what it means to get a diagnosis. And so, does everybody who is sad meet the criteria for being depressed? Definitely not. We all experience sadness sometimes after the loss of a loved one, change in jobs, relationships. So just because you feel sad doesn't mean you have depression. We did speak at length about these symptoms, but I'll go over them again just because I think it's important. I've had some patients who will come to me and they'll say, Doc, I'm not depressed, okay? I don't want that medicine, or that's not the issue, that's not the problem. And I'm like, Okay, but you just told me that you're not sleeping, you're not eating, you haven't gotten out of bed, you haven't brushed your teeth in 3 weeks, you're not showing up to your job, you can't stand to look at your wife, you have thoughts that, hey, if I didn't wake up tomorrow, that wouldn't be so bad, but you're not depressed. Okay, sure. So it's hard sometimes for people to appreciate, that the difference between when is this just sadness versus, when is it actually depression. Okay. So in order to meet the full, what we call criteria for being depressed, you have, or any other mental health diagnosis for that matter, you have to have at least a certain number of those symptoms that we spoke about for a long enough period of time at a significant enough level of severity. So do these symptoms interfere with the person's ability to do their job, to go to school, to go to work, to have their relationships with their family and friends, do their self-care, manage their home, manage their finances? So I put some questions in here that people ask me all the time, not just my patients, but friends, family members, people in the community. So these are ones I get a lot. So does everybody need medication? No, definitely not, all right? So, but the way that we're going to decide whether or not a medication would be appropriate for someone is by looking at the severity of their symptoms and the time frame that it has been going on for. So if things are not improving and the person's having a significant decrease in their quality of life and their usual measures or other measures that they've tried are just not working. So they've, been to therapy and they've been working on it and they've, they're trying to get out there and take care of themselves, and it's just a struggle, and they're, kind of worried, like maybe I might get fired from my job, or maybe I'm not going to pass my classes. Also, if someone is having any thoughts of hurting themselves or other people, that might also be a clue that, okay, this is actual depression, this is not just normal sadness, and that maybe a medication might be beneficial. So, I don't know about you guys, but I like pies. I'm from New York, so I like pizza pies, and preferably it's better if you have a whole pie, right, to yourself versus pieces missing, I think. So medication is just one piece of that pie. So you can have that piece and none of the other pieces, okay? And I think a lot of people have that belief that the doctor doesn't care about the whole pie, and I can tell you I care about the whole pie. We want to take a look at the whole picture. We want to see if the person's in therapy. There's a lot of research done about therapy, okay, and its effectiveness. If you take somebody who is depressed and put them under what we call an fMRI machine, which looks at areas of the brain that are lighting up before they start like a course of therapy, and you look at the areas that are lighting up and how and when and whatnot, and then give that person a course of psychotherapy, any kind, CBT, supportive, insight-oriented. After about 6 months to a year, their brain is going to light up differently in that fMRI machine. So I just think that that's cool as a person who, likes science and facts to kind of back things up. When people try to say, oh, no, therapy doesn't work, or like, I just went twice and I didn't feel any different. And I'm like, well, you got to give it some more time. And the fact that I know that I've seen these pictures of how the brain looks different afterwards, like that is proof to me therapy is doing something. So we have to really look at, are we incorporating that, into our delicious pie? We cannot forget the basics. So we really need to look at exercise, activity level, diet. Are you getting enough nutrients, vitamins? Are you doing things for fun and rest and relaxation like we talked about? Yoga, bowling, going for a walk, whatever it is that you like to do to relax, we have to let that out. you have to let that energy that gets built up, it has to be processed, okay? You want to also take an inventory of your stressors. If you're in a bad relationship or a bad situation that you're just not moving forward with addressing, and then that drama and that stress is just hanging around and hanging around, the medication, the therapy, it's only going to be able to help but so much, right? Because you have the same stuff going on. So, are you really willing to take that inventory and take that time and effort to say, okay, are there things that are in my life that I need to change as far as my relationships or my circumstances? So we do also want to avoid the use of alcohol, drugs, nicotine. Those are all ways that we can improve our health, right? So if we want to say, okay, fine, I really don't want to use medication. I have a lot of people that come in and say that to me, and I say, okay, fine, but then you need to be really doing your best. I need to hear that you're exercising, you're doing this, you're doing that, and if that's still not working, then we need to consider the medication. But I can't tell you how often I have people who come and they're like, oh, doc, you gotta help me, fix me, please, I'm depressed, I feel terrible. And I'll say, okay, well, what are you doing to take care of yourself? And are you getting up? No, I'm just sitting on the couch and eating a bag of potato chips and feel bad about myself, and and I'm just not not doing much. And I say, okay, well, and I give them some tools and some ideas of things that they can do to work on that aspect of it. And we may try medication. And then the person will come back and they'll say, oh, doc, that medicine you gave me, it's just not working. It's not working. I'm like, okay, but did you change your activity level? Did you change your diet? Did you start going to therapy? No. Okay, well, usually when I see then they're coming back again and they're finally like, what, yes, I did. I started going on a walk with my husband every night after dinner, which is a great time to go to on a walk, by the way, because it helps you to manage your blood sugar levels. And they'll say, oh yeah, finally I'm starting to notice an improvement or a change. But the medication can't do everything. You have to take that upon yourself to, do all the things that we know we're supposed to do, but we don't always have the motivation. And that's one of the tricky things about depression also, right? It's kind of like the time when you need to be doing the most to help yourself is the time when you want to do it the least. But being able to get through an episode of depression is about finding that energy and that motivation to change, and that can happen, at different times and for different reasons in different people. Okay, another question that I get asked is, if I start medication, am I going to need to take it forever? Right? Has anybody ever wondered about that? Oh, once I start it, that's it. I'm married to Prozac now. This is lifelong. Death till we part, and that's a great question. And unfortunately, because I can't predict the future, well, that's fortunate. I wouldn't want to be able to do that. It would take the fun out of everything. But because I don't know the future, I can't give people that answer of are you going to need to stay on this in the short term, in a medium term sense, is it going to be 6 months, 1 year, 5 years, is it lifelong? And that answer sort of plays itself out over time. So if somebody stays on it for a certain amount of time and then they have resolution of their symptoms, it's been 6 months, things are great, then maybe it can happen where you can work with your doctor to safely start to taper the medication. You never want to stop medications on your own, by the way, because you don't know that sometimes there can be unintended consequences or things that can happen. And most of these medications you're able to come off of them perfectly safely, but you do just want to do that with the guidance of your doctor. So then let's say we do that and we do it safely, then we just sort of wait and see. And some people may never need to go back on the medication again. Whatever it was, maybe it was a loss, that they, instead of grieving and just having regular sadness, that it did turn into an episode of depression. Maybe that does resolve itself and the person never needs to be on medication again. But if we see that after 3 months, 6 months goes by, they're coming back and they're saying, I'm just starting to fall back into that again, I'm starting to not feel right or like myself, then we might want to talk about that. Okay. Does taking the medication make me need to keep taking the medication? And that's a question I've been asked several times. And I think it's interesting because I think this goes back to the fact that a lot of people have a lot of misconceptions about what medications can do and what they can't do. And, you know, a lot of people, they maybe don't have the knowledge base to know. They haven't read all the studies that talked about, you know, the long-term safety of the medicine, you know, how they've, you know, tested it in, you know, 5,000, 10,000 people, or even more. I think probably Prozac has been studied in one form or another in probably over 100,000 people over time. So we have some pretty good information about what are the long-term pluses and minuses of it, what are the short-term pluses and minuses. And so I think it's important to have an open mind, because a lot of people will tell you, you know, a lot of things. And I have so many people who come in who will say, oh, well, you know, I really do want to try medication, but my mom says, and this is an adult, that my mom says that I shouldn't because she doesn't think that that's a good idea. And I said, well, respectfully, what does your mom do for a living? And not a mental health professional. Okay, so I respect that the, you know, family members do care, right? They really care about people and they want to do the right thing, but they might not always be informed. So if your car was making a funky noise and your cousin, who's not an auto mechanic, said, oh, that is your catalytic converter, okay? That's definitely what it is. You're gonna go take it to the mechanic. You tell them to replace your catalytic converter. And you say, okay, well, my cousin seems to care a lot about me and my car and, you know, wants the best outcome. So you go along to your mechanic and you're like, hey, you know, my cousin said that this is my catalytic converter and you should replace it. And the mechanic says, I definitely don't think that's what it is. I think it's this, and this is why I think that. Well, at that point, you wouldn't say, nope, cousin so-and-so said, so that's what I'm doing, right? So we understand that, like, on that side of things, but when it comes to mental health, you know, there's just so many misconceptions out there, and so many people are gonna tell you so many different things. I have some patients who end up, you know, they get on medication, and they're feeling so much better, and they have certain family members that are so uninformed and would, you know, tell them if they heard they were on it, oh no, you better stop taking that. That's gonna do this to you and do that to you. And so they get to a point where they just end up saying, okay, this is my personal and private information that is between myself and my physician or my therapist or, you know, my pastor, whatever, but it doesn't have to be, you know, something that you discuss with everybody. It's not something you have to be ashamed of, but it's something that, you know, other people can really influence you sometimes, you know, well-meaning people, but who are uninformed and may, you know, skew your thoughts and behaviors, you know, regarding use of medication. So, no, just taking the medication does not mean that you're going to be dependent or that you're going to, that the medication itself makes you need to take it. So let's say somebody has high blood pressure and they take high blood pressure medication. Well, it's not the blood pressure medication itself that made them have the high blood pressure and need the medicine. It was having high blood pressure that made them need the medicine. So I think that's something that people worry, like, oh, well, if I take this antidepressant and it affects my serotonin, when I stop taking it, is it going to make it so that my brain can't make its own serotonin, or that it's not going to, you know, do its own serotonin thing, you know, the way it's supposed to? And that would be a very scary thing, right? That, I could definitely understand that would be a reason why somebody would not want to take a medication if they thought that was true. But in many, many, many studies that have been duplicated over time, we find that it's just not the case. And in fact, you know, sometimes medications can help the brain to go back into its normal pathway and wiring. So we heard a bit about the amygdala tonight and things like that. And so what's supposed to happen in your brain normally is that one area will, you know, okay, let's say you're supposed to do something. So you know, things that maybe would be hard if you were depressed. So, okay, I need to get up, I need to eat, I need to shower, I need to, you know, whatever. And so one area of your brain kind of turns on and lights up, sends a signal to another area of your brain, which then sends another signal to another area, and then before you know it, you've gotten up, you've eaten, you've showered, you've done what you had to do. But when you look at disorders such as depression, what's happening is that that one area of the brain maybe is lighting up, but instead of sending the signal to the area that it's supposed to cause that behavioral activation, it isn't. It's maybe sending it somewhere else, back through your amygdala, back through your emotional centers. And so all of a sudden, you're just like, no, I don't want to do that. I'm not gonna get up. And so that whole signaling process that's supposed to happen in your brain, which is mediated by your neurotransmitters, it just isn't happening. And so when you take the medication, sometimes what can happen is it helps the brain, okay, now I'm gonna start here again and go here and go here and go here like I'm supposed to, and then the brain sort of retrains, like, oh yeah, okay, like a worn-in shoe, like, okay, that's what I was supposed to do. So sometimes sometimes the medications can actually help with that over time. So, does the medication cure the depression? I'm not gonna say that. All right, we're really not clear on like if, depression can be cured or not, but the medications can at least take the symptoms down to a point where they are not even there anymore and the person can function completely normally. Okay, I want to talk just very briefly about food and diet because that is a big part of my practice and what I do, and I think it is very important. They call the gut the second brain, and part of the reason why is because you have more serotonin receptors in your GI tract than you do in your brain itself. So when you take a medication like Prozac, which increases serotonin, the most common initial side effect, it could be upset stomach. And that's because your gut is trying to do a very good job, just like when you have an anxiety, your body is trying to do a good job and it's trying to say like, hey, there's something here that's not normally here. You might wanna like do something about that. But over time, your body adjusts. Just like when you put on a shirt, within a few moments, you don't feel it anymore. Your body starts to recognize that and it adapts. So we have flora in our gut, that's comprised of, bacteria, microbes that break down our food into nutrients and things that we can make useful tools out of, like our neurotransmitters, which are the Snickers bars for our brain, if you will. It makes it function, makes it run, makes it do all of its essential functions. And so without proper nutrition, there's no way. You can't just like make serotonin out of thin air. You have to have essential things from your diet that you take in order to be able to make these molecules. So we can give you all the medicine in the world that's gonna like squeeze out the functioning of the amount of time the serotonin hangs around to do its job, but if you're not eating properly and you're not getting a good balanced diet, you're just eating, McDonald's or whatever all the time, there's really very little chance that you're gonna be able to get yourself out of that bad place or out of that mood, or to maintain a positive mood moving forward. So yes, that is a big part of my practice. I do speak with patients a lot about what they're eating, what kind of supplements they're taking, are they on vitamins, do we need to check vitamin levels, and so what are things that, how can we use food as medicine sometimes too to heal ourselves? Or how can we avoid certain things? So some people do have sensitivities to food. There are some tests that you can do to look for that. They're not always helpful, but sometimes we can identify something that actually does make a big difference in the person's health and wellness if they just avoid eating that particular thing or if they add something specific into their diet. So, in conclusion, life is really about finding a healthy balance. So anytime we live in extremes, we risk coming out of that balance. And you can apply that in so many ways, but because I'm here to talk about the medication, that's how I'm going to put this into a frame of reference. So looking at things in extremes of saying, oh, well, I want to just take a medicine for everything. I want a medicine that's gonna wake me up, make me happy, put me to sleep, do this, do that. Well, that's probably not good. But to live at the other extreme where you say, I'll never take medicine, nope, not ever, never, 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 won't do it, no way, no how. That's probably not healthy either, right? You kind of want to live in that middle ground. And I'm probably, and I tell this to my patients, like, I'm no better. I'm really not. Like, about, once every year or two, I get like a crippling bronchitis. I don't know why, I'm just unlucky, I guess. And I will be dying, hacking up my lungs, like, just totally miserable. And then finally, somebody who loves me or cares about me will be like, please go to the doctor. I'm like, okay, fine. So I go, and they'll give me the antibiotics and the steroids, and I'll pick them up, and then they'll sit on my counter, for 3 days. And I'm still like, hacking, coughing, barely able to go to work, exposing more people to my germs. And why did I not take them? Like, just out of pure stubbornness. Like, so I understand that there's something inherent, I think, in our nature that says, no, like, don't take that, don't put that in your body. And that's probably a pretty good survival or protective instinct, but it is just that, it's an instinct. And we can't always go on every instinct we have, or we would just all run out in the street and do whatever we wanted. Like, we have to sometimes reprocess those things and those instincts and really ask ourselves, okay, does this make sense? Does it make sense that I'm coughing, hacking my lungs up, feeling miserable just because I didn't feel like taking my, medication that was given to me? And inevitably, I do end up taking it, and in like 24 hours, I'm not cured, but I'm like much, 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 much better. So I do understand it. I'm telling you, I do. I'm the worst patient. It's very hard to get me to take things. So I try to keep that in the back of my mind when I'm telling people, well, listen, this is what's happening with you right now. Let's examine the evidence of what's going on in your life and how things are not maybe going so well for you, and how, doing this or that might help you. And it's easy for me to sit there and say, like, yeah, go ahead, just take it, it's cool. Hope you don't gain weight, no problem. It's easy for me to say that. So I do try to understand that in the back of my head that, is this something that I would want to put into my own body? So if you or someone or that you care about is struggling, encourage them to go see somebody and find someone that does fit with your background, with your model of the way that you see the world. Mental health issues are prevalent, and it's not something you should be ashamed of, okay? It just happens sometimes, and we don't always know why. So recognizing that you need help and getting it, that's what strength is. But not recognizing it, not going and getting help, that's weakness. But being strong is saying, okay, I'm gonna face this. I'm gonna deal with it, even though it's hard for me, even though I might not wanna do it, even though it feels uncomfortable, it's different, it's weird. People might judge me. My family's gonna tell me I'm gonna die if I take that Prozac. But being brave enough to say, okay, something is going on, I need to seek help, that takes strength and courage. So, all right, well, that's it for me. Thank you again so very much. Thank you.
Thank you, Doctor. All right, now is the Q&A portion. So if you haven't, go ahead and text 22333 and text Ken Catane Jr. 176, all caps, so that you can send your questions. So let's start off. There's a lot of good questions that Brother Ken and I had to filter out, but we're going to try to get as much as possible. So this first questions go to whoever wants to answer it. What to do when you feel anxiety symptoms, but you don't know why?
Of course, it's anxiety. They both like, okay, it's Nikki's turn. Okay, so when you start to feel symptoms of anxiety and you don't know why, I think the important thing to note is that every situation you're involved in creates a thought. Every situation. And that thought is what produces the emotion or feeling, right? And the feeling or emotion that you start to have is what triggers your behaviors. So if you're starting to experience symptoms of anxiety and you don't know why, I always say to people, let's trace back. When did you first notice that you started having these symptoms? What was happening around that time? But there are simple things you can do to kind of help you hold over while you're figuring out what the source of the problem is, like deep breaths. Put your hands on your chest, one hand on your belly, your diaphragm. Take a deep breath in through your nostril and blow out like you're blowing through a straw. And I always tell people, do that 20 times. 20 times. By the 20th time, it normally gets you to calm down enough so that you are able to kind of get back on track. Because when we're anxious, sometimes we lose our ability to think rationally. And if you can't think rationally, then the anxiety is going to get worse. So a simple thing as deep breathing, hand on the chest, one hand on the diaphragm or your stomach, and take 20 deep breaths until you're able to figure out what the source of the issue is.
Okay.
My first thought is emotion regulation, so getting yourself stabilized in the moment so that when you're in a calm state, you're able to go back to trace those thoughts. Another technique that you can use is like a grounding technique I like to call 5 for 5. So thinking about 5 things for each sense. So 5 things you see, 5 things you hear, 5 things you smell, 5 things you taste, 5 things you feel. And that's your way of distracting yourself to the point where you're able to, like I say, find yourself in a homeostasis or a balance.
I think that's all awesome. Something that I have shared with patients to try is to, again, recognize that the body is trying to tell you or signal you that something is going on. And so focusing in and saying, like, thank you, body. I am grateful to you for doing your job. I appreciate so much the hard work you are trying to do for me right now to tell me something is going on. But nothing is actually going on. Like, we are okay, kind of working through it that way and almost talking to your body and saying thanks, but no thanks, like, we're good. And by the time you've gotten through that thought process, like, usually it's past enough for you to maybe figure out why it happened or, move on to the next thing.
Thank you. This question goes to the doctor. We often hear about imposter syndrome when someone gets a position at a job and they have the qualifications, but they don't feel like they're right for it. This question is, how do I combat negative self-talk?
That's really an awesome question. I think recognizing the fact that I will go out on a limb and say every single person in this room and world and whatever has felt that imposter syndrome at times. Being asked to be up on a stage in front of people tonight. I mean, you can imagine that it can happen to everybody. And so I'd say examine the facts. Why were you hired for that job in the first place? You were probably looked at over other candidates, that there was there was a reason why you were chosen, and being able to have that, work on your own self-esteem and your own inner dialogue, when it comes up and says negative things to you, that you can say, okay, what's the evidence that I have to believe that that is actually true, that I'm not good enough for this, or that I shouldn't be here, or the facts that, well, I did complete the training I needed to do, I was selected. So I think, examine the facts.
We just have to speak positivity to ourselves. Now,
Yes.
Go ahead, yes.
In addition to what Dr. Lenoche just mentioned, a lot of work I do with my clients is to travel back in time to our core issues. Because that didn't just pop up when you just got the job. That's something that's coming from your core. And the need for us to examine at what point did you get that message that you weren't worthy or good enough. So that's also another approach that we can utilize, is to examine your core and where those issues stem from.
Nikki, I'm glad you spoke up, because this next question is to you. Stand over here.
The question is, what is the best way to approach addressing mental health issues or finding a therapist for your children, specifically teenagers? Because I know that you deal with teenagers, so, you know, everyone else can answer, but I want to ask you first.
So, in trying to find a therapist for your teen, the first thing you want to know is that person's experience. What is your background? What kind of training have you had? How long have you been working in the field? And I would say you want someone who has a diverse experience. So, sometimes I would say play therapy, and that may sound silly because it's a teenager, but I can't tell you how many times teens sit in my office and they don't want to talk, and we do puzzles and they start talking after us doing puzzles. Another thing is I'm a big advocate of, like I say, EMDR therapy, because oftentimes teenagers don't necessarily want to talk about the specific problem, but that type of therapy allows them to kind of preserve their dignity and keep that information inside while you're teaching them how to process whatever it is that's triggering feelings of anger or inadequacy. So it's important to ensure that the therapist has experience. I would say try to find someone who has more than five years experience, I would say. It's good to work with interns, but you also want to make sure that person is licensed, because what you don't want is for the situation to get worse because of the inexperience. So experience is a plus. You want to find out what methods they utilize specifically for kids. Cognitive behavior therapy is an awesome approach for kids because their thoughts are so distorted oftentimes. They're so eccentric and self-centered. Everything is about me. And oftentimes working with a therapist who's trained in cognitive behavior therapy, they're able to help them to examine their faulty thinking.
Yeah, this next question is to you, so you could kind of tie it together with the teenagers, and also how do you encourage someone to seek help and get therapy when they don't see there's a need? Because, you know, I could put those two questions together. We could have a family friend who's dealing with a teenager, and we're telling the family friend the teenager needs to seek help, but they might not see it that way.
Well, I was going to piggyback on what she was saying. Definitely find a therapist that's knowledgeable about the family systems and that aspect of therapy, recognizing that one person does impact the dynamics of the family and their role and their responsibilities. Another thing to do is find a clinician that's going to be willing to educate the family or the parents on what's going on with their child. And that's very important because what happens in therapy doesn't just stay in therapy. Yes, there's a confidentiality agreement, but there are some therapists who incorporate homework. Like the same things that are being taught within the room need to be perpetuated in the home. So it's very, very important. Once the family gets a better understanding and a respect of the therapeutic process, they're able to take those same things and incorporate it in their own parenting styles as well.
I'm sorry, there was one thing I forgot to mention as well. Parents, if you are taking your children to therapy, and I mean this from the bottom of my heart with love, understand that the kid is not the only issue. The child's behavior is typically a symptom of a problem within your family unit. So if your child's acting up, start by looking within your family. Is there disrespect between you and your spouse? Is there abandonment issues going on? Are you disrespecting your child? Because oftentimes as adults, we're so disrespectful to kids. The way we talk to them, the way we treat them. And before you take your kid to therapy, or understand that if you're taking your child to therapy, you must be willing to do therapy on yourself as well. Because monkey see, monkey do, children are sponges, that behavior was learned somewhere.
I wanted to ask the next question to the doctor and kind of continue with the family aspect, because this question is very vital. It starts off with, how do we deal with parents who see their children as quote-unquote therapists?
I think it's mine. I don't know.
And also, how do you find a therapist for those parents who are stubborn to see one?
So the question is, so when the parents are using their child as a therapist, is that sort of like an adult, maybe?
Yeah, well, whether it's older teenager, but one parent is venting to the children about the
Sure.
other or family member, and how do we get those parents to go see a professional when they're being stubborn, seeing someone like that?
Right, and I get that a lot. When people come into my office, I would say, 30% of the time is about, okay, here's a distinct plan of what we're going to do. 70% of the time is dealing with the resistance that the person has towards medicine, therapy, what have you. So you come up with your ways that you try to use to help people to kind of wrap their mind around it. And one of the things that I hear all the time, when I say, well, listen, okay, if you want to feel better, you probably really do need to see a therapist. And they'll say, yeah, but, I'm very close with my mom. We talk all the time. She's like a therapist to me. And I'm like, well, that's really great. But so in that sense, mom is a social support, is not a therapist. Therapists go to school, they get trained. When you go in there, there's a whole plan of action of what's happening. There's a beginning, a middle, and end. When you're just speaking with an untrained, but caring friend or family member, they're really just able to listen, but they're not doing actual therapy. So I use the example of like, well, we could probably all go to the gym and figure out how to make the machines work. Okay, but if we go there with a personal trainer, like we're gonna get buff like a lot faster, So it's like, sure, you might try it on your own, but you really should have the guidance of an expert. So that's how I try to put that, to them, that, why they should be using an actual therapist instead of a family member.
I am gonna take this to Nikki. What is the best advice for someone feeling overwhelmed to the point of having panic attacks? I've simply learned to simply just detach emotionally from situations. I figure that's one thing that you shouldn't do, just detach yourself emotionally.
That's actually the worst thing you could do.
All right, I just
is
got a
to-
credit.
is to detach yourself emotionally, because the problem's still there. So you can detach as much as you want. Things are constantly going to be triggering you. The suggestion I have, feeling overwhelmed, I always tell people, planning reduces anxiety a lot. It's okay to say, no, I can't do it. It's okay to understand that you're not a superhero. You don't have to be involved in everything or doing multiple things all at once. When I get overwhelmed, it's normally because I've taken on too many tasks all at once. You're one human being trying to juggle multiple things, and your brain's warning you and your body's saying, enough. So if you're feeling overwhelmed, take a step back, take a time out, give your body and your brain a break, write down a list of things that you're involved in, and really ask yourself, am I busy being productive or am I busy wasting time? Big difference, because you can be so busy doing multiple things, but you're not being productive. You're wasting time, and that can be very harmful. So take a step back, do some self-care, write down a list of the things you're doing, why you're doing, what's the purpose of it, and evaluate if you're busy being productive or you're just wasting time.
Sierra, this next question is, I think it's in your area. What's the difference between panic attacks and anxiety?
Well, panic attacks are symptoms of anxiety. So, I don't.
If you're having a panic attack, then you're suffering from anxiety.
Yes.
Okay, so that was cut. That was straightforward. Next question is, what I would suggest this to Nikki. What are some tips with working with a counselor that is not of the same faith as you? Do you suggest that they do that, or the counselor suggests someone else that's in the same faith as them, or should just strictly be in a professional level?
I've actually worked with therapists on me who are not Seventh-day Adventists. They were awesome therapists. They were Christians, they were just not Seventh-day Adventists. However, our beliefs were somewhat aligned in the sense that they understood and believed in God, the power of God, and realized that they were not, in fact, healing me, and they were relying on God's spiritual intervention to provide the guidance we needed, in collaboration for me to do the work. So if you're seeing a therapist who's not a Seventh-day Adventist, you at least want to find out what their foundational beliefs are as it pertains to Christianity. I've seen people go to therapists who are not Christians and get told, you should just walk away and divorce. Or, yeah, no, well, you're depressed and praying is not going to work. You really just need to go get on some medications. And that's so contrary to your beliefs as a Christian to tell someone praying doesn't work. It's like you going to see someone who's an agnostic, or you're going to see someone who's totally anti-Christ. There's nothing about Christ. So you really want to ask that person, you have that right to interview your therapist. That first meeting should be for consultation. All you're talking about is, what is your educational background? Do you have religious beliefs? What do you think about God and the role he plays in therapy? What is your belief about faith and the Bible? You have that right to screen out that therapist to make sure it's a good fit for you. Don't walk into the therapy session feeling intimidated because this person's supposed to be an expert. You are the expert in your life, and you have a right to interview that person.
Thank you. This one is actually, I think a lot of us could deal with it. It says, how do you remain present if your anxiety stems from over-planning? And that could go to anyone who wants to answer it.
The thing about anxiety, guys, and I want you to understand this, you shouldn't wait until you have a panic attack or anxiety to be taking care of yourself. The thing with your brain is if you're constantly training your brain and your body and nurturing it to stay interconnected, then when crisis comes, the deep breaths become second nature. So for me, driving the way here when my body started to act up and tell me, oh my gosh, okay, it's gonna be scary, I didn't even realize I started talking to my amygdala. I was like, listen, I don't need your help. I got this. I didn't have to give it a second thought because it's something I do on a daily basis. If you're not being intentional about being selfish for yourself, then your brain's gonna terrorize you. Set aside daily practices, practice good daily mental hygiene, because if you're doing that, it becomes second nature to you.
And at the core of it is self-awareness. Mindfulness is very important. I know oftentimes we get lost in the rat race of life where you're trying to balance work, you're trying to balance the kids, you're trying to balance school, you're trying to balance everything. But when you get into the practice to set aside time to check in with yourself, have conversations with yourself. You're not in the midst of having a hallucination. Just say, body, how am I doing? What are some good things that are happening today? What are some things that will bring me out of that state of anxiety or depression? That way you can begin to start formulating a proactive plan or a crisis safety plan to help bring you to some sense of normalcy.
So would you say that those are tips of handling stress management? One of you guys did mention the tapping, but, just talking to yourself, breathing, and making sure that, everything, you got some positivity. Go ahead.
If everyone else is talking to you and you're not talking to yourself, then you have a problem. If you're listening to everything going on outside of your body and your mind, and you're not spending time feeding your brain with positive affirmations, then there's a problem. And the thing about us is once we say we're stressed or we're depressed, everybody becomes an expert therapist. Everybody becomes an expert therapist, but no one went to school to get trained as to how to help you appropriately. So you have to be very careful about who you share your information with. Don't assume that because someone's nice to you that they are emotionally mature enough to help you or guide you through the difficulty you're having. Your mind and body and your spirit, they're not meant to be disconnected. They're supposed to be connected with all. And we're not supposed to be spending time in our minds thinking all the time. That's a sign that something's wrong. You're supposed to be in the present. So I'm sitting here now, I'm noticing how warm my body feels on the chair. I know where my feet are located. I feel my neck. I feel everything, the air going on around me. That's what's supposed to be happening. You're supposed to be in the present. If you notice you're spending a lot of time in your thoughts, then that means that your entire system is disconnected from each other. Your mind's one way, your body's one way, and your spirit's another way. And that's not supposed to happen.
One last question is for everyone, but we'll start off with the doctor. How do we prevent ourselves of being that quote-unquote professional where we see stuff online or we heard it
Dr.
on-
Google?
Yes, Dr. Google or WebMD, that it doesn't, just because we Google the symptom, we don't dive off the deep end. How do we prevent ourselves from diving off those deep ends?
That is an awesome question. In an age of time where information is so readily available, it's easy to go out and find things that might seem like facts. There's opinions, but if you have not been trained, if you've never been given the appropriate scope or lens to view that information with, you can often misinterpret it, misunderstand it, get yourself, everything is cancer, okay, when you look it up online, okay? Like, oh, my eye hurts. I have eye cancer. Wow, gosh, why didn't I think of that? Like, I had a rash not even, 8 months ago. I made the mistake of looking it up, and I was like, yep, it's cancer. And I'm a doctor, okay? It's like we all do it, but you have to be careful because a little bit of information without the proper lens can be harmful to you. And if you are working with a practitioner or provider that you trust, we are seeing many, many people each month. So, I'm here to partly to talk about the medication, but somebody may go home and read up on something that I've prescribed to them, and they come back and say, oh, I read that it could do this and could do that, and I said, well, that might be true, but I can tell you that in real life of treating people and prescribing these things, and I have gotten to see in real time what's actually happening to people when they take this. What is happening, what isn't happening, that I often say, if I were to give you the side effects of a Tylenol, potential side effects, but I covered up what it was, you'd be like, oh, I would never take that medication. But because we've all taken Tylenol and our ears didn't bleed and our eye didn't pop out, we're like, okay, Tylenol's cool. We're all right with that. But when it comes to things we're not familiar with and you see these horrible, possible side effects, without that scope and lens to really look at it critically, you could get yourself so overwhelmed that you become paralyzed, you can't make a choice, you don't utilize something. So having someone that you trust to kind of guide you and say, I would not give you something that I thought was actually going to do A, B, C, D, so.
And even in the beginning stages, if you're not 100% sure, go get a mental health assessment. There are a number of clinics out there, like the Henderson Clinic, where you can just walk in and request a free behavioral mental health assessment. The Henderson Behavioral Health Clinic here in Fort Lauderdale,
Okay.
you can walk in and receive a mental health assessment. There are a lot of therapists out there who also do mental health assessments as well, and quality of life assessments too.
And finally, understand, guys, that oftentimes when we're struggling with I like to say emotional dysfunction, sometimes our thoughts are so distorted. And if I'm already struggling with paranoia and I go read up on the side effects of meds, what do you think is going to happen?
It's going to get worse.
That's right. And if I'm already depressed and I'm struggling with suicidal thoughts and I go read up and it says may cause suicidal thoughts, what do you think I'm going to think? Right, I'm going to catastrophize and look at the worst case scenario. So our thoughts are often already distorted. What you don't want to do is take on the role of a doctor. I always tell people, stay in your lane, consult with someone who that's their expertise to kind of guide you through it.
Okay, ladies and gentlemen, let's give our panel a round of applause. Once again, we have Nikki Cameron, who is a social worker. We have Sierra Hillsman and Dr. Aubrey Lenoche. Great job, guys. Listen, we had Jesus in Therapy. We had a great turnout. I spoke to some of the leaders. I hope this is a yearly thing. I'm putting it out there. But I'm so glad to have you. But we wouldn't be remiss if we didn't have any gifts for our panel. So Mr. Ken will come up here to present our panel with some lovely parting gifts. Just to say thank you for coming out and giving us information so that we could deal with our day-to-day issues. Once we also have some snacks in the overflow room for us to eat, and also our lovely panel guests have a table. So if you want to talk to them, like if your question wasn't asked, you could keep it brief. It's not a therapy session. They do charge. So just a nice little brief question, get their information, and they'll kind of help you out with that. So we began with prayer because we talked about therapy, so we're going to talk to Jesus, and we're going to ask the pastor to come here and provide benediction for us. So if everyone could stand up for us.
I would like to extend a word of thank you for this wonderful workshop. I think this is a great beginning, but this has to have continuation. The reality is mental health is a problem in the churches too. Sometimes, as it has been pointed out, even pastors have issues. Okay, so from time to time, even I need this. Okay, so thank you so much. Heavenly Father, we thank you for the privilege we had to sit together and listen to these experts talking to us about the intricate reality of our mental health. We thank you for providing such wonderful people that can open our eyes and give us some glimpses of what can be going on with us and how we can get help. Father, we pray that you will bless their work in their profession, and they will be used as instrumentals of your goodness, of your grace in the life of those people that are suffering. Father, we pray that if there was an alarm going off in our minds tonight, we will listen and we will go and get help if that's what we need. And we will not just act as if nothing is happening. Yes, we are bringing it to you, but we are also going to seek help so that the lack of balance in our body, in our psyche will be reestablished. So we pray, Father, that you will give us wisdom and light so that we can do the right thing. And as we depart now, we pray that you will take care of us, you will protect us, and give us the fulfillment of our life in Jesus Christ, to the Holy Spirit. Amen.
Hi there. I want to thank you for joining us for our worship service today. I hope that you enjoyed it and that you are blessed. If you are looking for more uplifting content, I'd like to invite you to join us at Plantation SDA TV for more uplifting content. If you're in need of prayer, please join us at plantationsda.org and let us know how we can pray for you. And if you ever happen to be in the Plantation, Florida area, please don't hesitate to stop by and see us. I'll see you soon. God bless.